Welcome back to the channel. Today we're going to talk about sarcoidosis. Sarcoidosis is a systemic disease characterized by the immune system malfunctioning and causing inflammation in various organs, most commonly the lungs. It often appears between the ages of 20 and 40 and is more common in people of African descent. Let's dive into the interesting relationship between the mind and body connection of sarcoidosis. As always, this video is meant to be informational, and in no way is it meant to diagnose or treat any condition. If you suspect you may have sarcoidosis or any condition discussed in this video, please reach out to your local healthcare provider for a proper diagnosis and treatment plan for you specifically. Let's get started. Okay, let's start off with a quote that really resonates with me. "I'm constantly fighting to protect my space or clan." This speaks to a major underlying theme we see in many of our patients who develop sarcoidosis. There's often some sort of perceived threat to their personal space or autonomy, and in response, they unconsciously create somatic symptoms to protect themselves. Now, this doesn't always mean there's an actual external threat. Many times it can be something internal, like a feeling of losing control over their life circumstances. Let's meet one of our patients. Our patient is a 30-year-old man presenting to the clinic with a cough and shortness of breath. He's been having these symptoms for about a month, and it seems to be getting worse. He's also noticed some joint pain, especially in his knees and ankles. He's tried over-the-counter cough medicine, but it hasn't really helped. He's a bit reluctant to talk about anything else, but eventually opens up about his home life. He grew up with an alcoholic father who was abusive towards him and his mother. He moved out as soon as he could and has been trying to build a new life for himself. But recently, his father reached out to him and asked if he could move in with him and his new family. His father said that he was getting married and had 2 young children with his fiancée. At first, our patient hesitated, but ultimately agreed. However, within a few weeks of moving in, he started to feel suffocated. His father and stepmom seemed to be controlling and constantly criticizing him. They would make comments about how he should be more like their kids, which made him feel inadequate. In addition, his father's new wife had 2 kids from her previous marriage who would often tease and make fun of him. This situation was becoming increasingly stressful for him, and he started experiencing symptoms shortly after moving in. It makes sense that he might feel some type of threat to his personal space and autonomy. Moving in with his father puts him back into the same environment that he spent his childhood in, triggering old traumas. It also doesn't help that his father and stepmother seem to be controlling and critical, adding to his stress levels. Our patient presents with symptoms consistent with sarcoidosis. Tests such as a chest X-ray and a biopsy are ordered to confirm the diagnosis. After reviewing the results with our patient, we explain that his symptoms are likely due to a condition called sarcoidosis. We talk about how it's a condition where his immune system is overreacting and causing inflammation in his lungs. We explain that while there is no cure for sarcoidosis, there are treatments available that can help manage his symptoms. We also discuss the importance of finding ways to reduce stress in his life, as it may be contributing to his symptoms. As part of his treatment plan, we refer him to a therapist to help him process his past trauma and develop coping mechanisms to manage his stress. Therapy provides a safe space for him to explore his feelings of anger, sadness, and betrayal that he experienced growing up with an abusive father. Through therapy, he learns to challenge the negative thoughts and beliefs he developed during childhood, such as, "I am not good enough," or "I do undeserve to be happy." He starts to develop a sense of self-compassion and recognizes that he doesn't need his father's approval to be successful. As he continues to attend therapy sessions, he learns various coping skills to manage his stress levels, such as deep breathing exercises, mindfulness, and progressive muscle relaxation. He also starts to set healthy boundaries and assert himself when he feels uncomfortable or disrespected. Over time, his symptoms improve, and he's able to maintain a healthy balance between work and personal life. Another great example of the mind-body connection causing sarcoidosis can be seen in this patient who developed the condition after experiencing severe anxiety. This illustrates how mental health can significantly impact physical health and the importance of addressing both aspects for overall well-being. I think this quote sums it up nicely. "I feel unprotected in this world, searching for a place to hide." This ties into the feeling of vulnerability that many of our patients experience. For example, when significant changes occur in their lives, such as a death in the family, divorce, or job loss, they feel vulnerable and unprotected. This can trigger a stress response in the body, leading to sarcoidosis symptoms. Unresolved grief or suppressed emotions can also contribute to the development of sarcoidosis. Our patients may struggle to express or process their emotions, leading to a buildup of emotional tension that manifests as physical symptoms. Here's another example. A married woman in her late 30s presents to the clinic with complaints of a dry cough and mild shortness of breath. She's tried over-the-counter cough medicine, but nothing seems to help. When speaking with her, we learned that she recently went through a messy divorce. During the legal proceedings, she experienced constant betrayal and manipulation from her ex-husband, who was attempting to take full custody of their child. Throughout the entire ordeal, she felt helpless and vulnerable, unable to protect her child or herself from his actions. She felt isolated and alone, unsure who she could trust. As the divorce dragged on, she started experiencing symptoms of anxiety and insomnia, which then progressed into a cough and difficulty breathing. Her case highlights the profound impact of emotional distress on physical health, underscoring the importance of addressing mental health concerns in the context of sarcoidosis. The experience of betrayal, manipulation, and helplessness during the divorce led to chronic stress and emotional trauma. Unable to cope with the situation, her body developed sarcoidosis as a manifestation of her psychological distress. The last quote I want to go over is, "There's no one left to defend me." This speaks to another common theme we see in our patients, feelings of abandonment or isolation. For example, when they lose a loved one or become disconnected from their support systems, they feel unprotected and vulnerable. This can trigger a stress response in the body, leading to sarcoidosis symptoms. Loneliness and social isolation can also play a role in the development of sarcoidosis. Some of our patients may struggle with feelings of disconnection or alienation, which can lead to a breakdown in their immune system and the development of sarcoidosis. Here's an example. A young man in his early 20s presents to the clinic with complaints of fatigue and a non-productive cough. He's tried over-the-counter cough medicine, but nothing seems to help. When speaking with him, we learned that he recently lost his grandmother, who was the only family member he felt truly cared about him. Growing up, he had a strained relationship with his parents, who were emotionally distant and neglectful. His grandmother was the only person who showed him unconditional love and support. After her death, he felt completely alone and abandoned, struggling to cope with his grief and feelings of isolation. His symptoms started shortly after her funeral. The sudden loss of his grandmother triggered a major shift in his life, leaving him feeling vulnerable, hopeless, and unsupported. He didn't have anyone left who truly understood or cared about him. The combination of grief and loneliness overwhelmed his ability to cope, leading to the development of sarcoidosis. In summary, the mind-body connection plays a significant role in the development and progression of sarcoidosis. Stressful life events, unresolved grief, and feelings of abandonment or isolation can trigger the onset of symptoms in susceptible individuals. By addressing the emotional and psychological aspects of our patients' health, we can help them better manage their sarcoidosis and improve their overall well-being. Remember, the mind is a powerful force, and it's essential to consider its influence on our physical health. Thank you for watching. Take care of yourself and be well.